Kubor ka Batisi TV. Lawan Rashapi da ka Frank Motors. I am Tata Punch. Price starting at 5.80 lakhs. Ringkat bat ka net foodish. Ordar mapi nginwan ra amangi hakir dobyeng jongpi.
Ka Holy Cross Health Center ka Shlem Ai Jing Sumar ka Badan Hagashnong Pendeng Umyong Eastern West Khas Hills District. Haga Pratarik Risau Arajar Arpuar kala Rakhe yo Maumer jong jingdap Arpusan Snem daga program ka ba Isyongkun haga bau menteri ketanat ka koit ka kya jong Sorkar Jilla u James PK Sangma ula longkum Kongsan harengkat ka jingedon lang jong Principal Secretary ketanat ka koit ka kya u Sampat Kumar u MDC ba Batscam Rentatiang u Lengdo Sad jong Jalan Namba Shillong u Most Reverend Victor Lengdo u Deputy Commissioner jong Eastern West Khas Hills District uba Wilfred Nongsi ka Provincial Superior jong Holy Cross North Indian Province ka Reverend Sister Lynette ka Administrator jong Holy Cross Health Center Mairang ka Reverend Sister Jessie Jose ki Doctor ki Officer ki nongilam shnong ka thain bat ki wei ki balasha khot sngoba Lapan po pan piang ya gane gajing Rakhe da gijing shat bat gijing ruai na ginong trei jongga Holy Cross Health Center bat hagane ga sngi lapan kup burom ru ya ki katto gat ne ginong trei jongga ne ga Shlem Sumar nongpang ki bala ai gajing shakri shaki pat ba hagane ga kam la bon snem.
Today, as we are coming here to thank God for the gift of the last 25 years, we assure a prayer and blessing that may this center will grow in serving people of God all around of this area. Once again, I'm very happy to see all big shot has come today, especially our friend here, Shri James Sangma. You are in charge of most important portfolio. Health, because people need health. And family, all of us come from family. If the family is good, society is good. If the health is good, everyone is good and happy. Therefore, we thank you so much for your work done to the society of the state of Meghalaya. And all of those doctors and nurses, we are also grateful to you. May God continue to bless you. Congratulations. We pray for you. May God bless you.
This wonderful institution that today we are all gathered here to celebrate the Silver Jubilee. And I would like to congratulate Sister Lynette, Sister Jessin, Sister Noreen, all the sisters of the Holy Cross congregation on this really red letter day, celebrating 25 years of an institution which has provided human service to not just the people of Mairang in particular, but to this entire region. We as a government, we also have many medical institutions that we run, that we, through these institutions, are trying to provide healthcare services to the people. Let me tell you, it's an insane challenge trying to manage healthcare services in the state of Meghalaya. And when I say it's an insane challenge, I can just imagine what kind of difficulties that an institution being run by the sisters, or an institution which is non-profit, which is established on welfare, what kind of insane challenges that the sisters must have gone through in these last 25 years. Government is an institution on its own, having many ways and means to support such kind of a structure. But for an institution, a congregation like the Sisters of the Holy Cross, to run an institution, and that too successfully, for 25 years, really it goes to show that this has not been an easy journey. I know for sure it has definitely not been an easy journey for them, filled with so many challenges. And it really goes to show how kind God has been on the sisters, giving them that kind of help when it was required, giving them that kind of dedication, and the drive to go on through all those difficulties that they must have gone through these past 25 years. We hope and we pray that one day the Holy Cross Health Center is going to be a tertiary care center, which is going to benefit not just the people of Mairang, but the entire region, because this is a region which urgently requires a lot of impetus and inputs in the healthcare sector. And in line with these state health policy, we are also focusing on maternal and child health care, which Mr. Sampath Kumar is not just because of his position as Principal Secretary of Health, but also social welfare, how the government can, in a very a holistic manner, look at providing care to infants, children, adolescents, and to mothers. For that, the early childhood program has been launched, and it's really working really well. I'm indeed very, very honored to be part of this program. Um, I feel honored, especially because I remember Sister Lena and her contributions. I really look forward to whatever collaborations that we're having with this congregation, and how we can take that forward, because this government is very, very keen on having more PPPs, having more ways and means by which we can mutually have collaborative exercises whereby we can take healthcare to a different level.
So this kind of a work is happening. I must tell you that like this particular district, though it's a new district, somebody has said youngest district, I think our Archbishop has mentioned, it's doing very well. And we got a very good team, health team, both in the public sector and also private sector, like in the sense like especially the Holy Cross and the government hospitals, the way they are working. Last year, or before years, during this period of like 8 months period, we used to have in this particular two districts, we used to have about 18 to 20 mothers used to die. This year, it has brought down to 4. So what I wanted to say is that from 18 to 4, it's a very good effort in the sense like now our idea is, in fact, our Honorable Health Minister says that we should bring it to 0. We should save every mother, every child. So we should not allow any such thing to happen. So I think it's a great work is happening all over. I think this is a good example of collaborative work. Collaborative work means both the government and the mission together, jointly working together, in the private sector working together, and see that how actually we can provide the best and affordable healthcare. And more importantly, what we have to learn from today's event is that how to provide a respectful, caring healthcare, which actually the Holy Cross sisters have done this, and it's a great example that I think one should learn from them. And I really give my the best wishes, and I think this hospital should grow in big, and it should become a tertiary hospital. When you celebrate the golden jubilee celebration, it should become a tertiary hospital. Already you are providing some of the tertiary services, but I hope by then, I think definitely it will grow. And I give my warmest wishes to everyone, and also thanks to your human service.
I was informed that at the request of the public of Mairang area, Reverend Father Cornelius Thiem, the then parish priest of St. Thomas the Apostle Parish, Mairang, at that time, took up the matter with Most Reverend Hubert D. Rosario, the then Archbishop of Shillong Metropolitan Archdiocese. The Archbishop then entrusted the matter to the Sisters of Holy Cross Mensingen, and in the year 1991, they purchased the plot of land where Holy Cross Health Center stands today from one Shri Sinkar Kharbolong. Although the foundation stone was laid way back in July 1992, the construction work was started only in 1995 and completed in November 1997. Initially, the health care center started only with 10 beds, and now it has been expanded and increased to 60 beds with various service facilities such as X-ray, the lab unit, the ultrasonography, operation theater, the pharmacy, indoor and outdoor patient services, rural health services, occasional medical camps, mother and child health programs, health education for both indoor and outdoor patients, free clinics for expectant mothers, mental clinics, and many others. Holy Cross Health Center is also closely working in collaboration with the state government and other like-minded agencies in the implementation of various health programs like MHIS, JSY, NTEP, ICTP, and others. And now, 25 years of service and going on. Jubilee is a time to fondly remember and celebrate the things already done and achieved. It is also a time to look ahead to more milestones. As a district, we are very fortunate to have a good healthcare center like this in the heart of the town, where everyone in need of healthcare can have access. I am told that during the last 10 years, the average annual number of outpatients is 15,000 plus. The average number of inpatients is 3,000 plus. The average lab investigation per year is 20,000 plus, and many others besides other activities in the various departments of the health center. What a commendable service. You certainly deserve a big congratulations.